What's up, y'all? Welcome back. So I got this comment a couple weeks ago, and so today's video I'm gonna walk you through how to do your own billing on the SimplePractice platform. Now, SimplePractice, if you're not familiar, is an electronic healthcare record system that many of us healthcare providers use, and so it gives you now, I would probably say within the last 2 years or a year or two, something like that, that it's been giving us this feature to now allow us to complete our own billing. Now, if you want to, take billing and contract it out to somebody else, I completely understand. But for those of us who are still growing and still trying to learn the process and really watch where our money is going, this might be of interest to you. So I'm so excited to go through this with you. So we are gonna go live into SimplePractice. So let's get to it. All right, so welcome you all to SimplePractice. So I'm starting this video under the assumption that you are already using SimplePractice, and therefore we are enhancing your capabilities around using SimplePractice by teaching you how to bill from SimplePractice. So we're going to use our test client, Johnny Appleseed, and I'm going to go in and demonstrate how I would bill for a session with Johnny Appleseed. We want to make sure that a couple of areas are complete before we go ahead with the billing. So one of those areas is primarily, do we have is an appointment scheduled? Like, believe it or not, like, if that's not scheduled, then you're not going to be able to go forward and go ahead and bill this session. So once we have a session already in place, that is excellent. The other thing that we want to make sure of is that there is actually a treatment plan in process, or actually in the chart. And so with the treatment plan, what it's able to do is not only show and highlight the diagnosis, which is necessary for insurance billing, but also it demonstrates to the insurance companies and the reviewers that we have a treatment plan. Like, we work together with the client to identify treatment goals that we will be revisiting during the course of treatment. So that is complete, and so that is a good sign. So this claim 1500 CMS 1500 form allows us to bill insurance, and is standard across all healthcare providers in order to bill and seek reimbursement from insurance companies. Another area that it's really critical that we want to make sure that our clients complete is the insurance part. If that insurance information is not placed incorrectly, you will have difficulty billing. In fact, there may be times where it's rejected, or it won't even go through. SimplePractice won't even allow you to go through. So you want to make sure that the insurance is completed, the client treatment plan with diagnosis, and a progress notes are all completed in order to properly move forward and bill for this service to the insurance company. Also, just an FYI, I made up this insurance. Well, I just clicked out one of many insurances that SimplePractice has in their database, and then I just created a random member ID number. So all of that is well and put together, or at least placed in together correctly, seemingly at this point, so we can move forward in terms of our billing process. And I just want to emphasize, sometimes it's not general practice for us when we're using these EHRs, depending on your practice, to always put in that diagnosis. I just want to reemphasize, when you're billing insurance, it's absolutely necessary to have a diagnosis in place in order to move forward and be able to and bill for those services. All right, so we are back, and I went ahead and put in the basic information, like the address, the sex of my client. I made everything completely up. None of this is real information. Just giving that disclaimer in case anybody is worried about any HIPAA violations or PHI being unintentionally released. And so I wanted to just clarify that. So let's go ahead and go back to our Johnny Appleseed. I nicknamed him Apple. So you will see in this chart, he's now referred to as Apple. We're going to create the claim CMS 1500 form, and we're billing for that January 31st visit, which happens to be today, because again, we put in that progress note, we put in that treatment plan, we put in that diagnosis, all the demographic informations are completed. So let's go ahead and create our claim. Now you will notice it says type self-pay amount $0. Please understand that this is just a demo, and that I'm walking you through the process. So we're going to create a claim. Insurance claim created. And what you'll see is that again, SimplePractice generates this lovely CMS 1500 form, which is a standard for healthcare practitioners all over. And as you can see, SimplePractice pulls the data from the client's chart, from that treatment plan, that diagnosis, and pulls it all over here to the CMS form. So we have our member ID, we have our client's address. I made it up. And any of my Disneyland people out there, that 1313 Disneyland Drive, Anaheim, California, does that sound familiar? It's the Disneyland address. So we also sex and date of birth, again, in terms of client identifiable information, that's really important for insurance purposes. No other insurances. If they had a secondary insurance, you can add that here. Let's see, policy group, all that, date of birth, again, all that information is put in. And then we have our diagnosis, right? So I only put F32.0, major depressive disorder. Now, if there were secondary diagnoses, you can certainly add that into the treatment plan. That's how you would reflect that, and that's how it would be reflected here on the billing form. And then most importantly, you have here the data service, right? So we met with our client today, allegedly, in the office. And our procedure code, now that procedure code is actually incorrect. Now, if we were billing this as the first initial evaluation assessment, I would do the 90971, but it defaulted to the 90837. That's not a big deal. You can go ahead and change that if necessary. But for the sake of this and going through, we're going to just keep that as such. Here is where you put your charges. So again, you set your charges way in the beginning when you're meeting with the client and setting up the appointment. So that is reflected based off what I put there. I put $0 because I don't want to confuse my system. And then, so that will reflect that. And then the rendering provider. Now here I'm using the example of a provider on my team. I'm blocking out the NPI number just for safety purposes. But this is the one of the providers on my team that happens to be the provider that saw this client and did this session. So there's that. Then it's electronically signed automatically from SimplePractice because it holds your signature. Then we have our facility name, billing provider information, MPI, all my personal information. You're seeing that. And then from there, once you get to a place where you feel like, okay, all the information is put in, it's good, it's solid, I feel comfortable with it, you simply hit submit. And just like that, it goes automatically to the clearinghouse. The clearinghouse will have a look at it. If they have any issues, they will reject it and send it back to you and tell you, give you information in terms of what you need to fix or update for them to be able to process it through and forward it to the insurance company for payment. And so that is pretty much it. It's pretty simple. Once you get the hang of it, or at least once you do one, you pretty much get into the swing of things, and it's sort of becomes second nature to you. And again, if you want to carve this out and hire a biller, you could add to your team of your team members on SimplePractice a person who's specifically dedicated to billing. I also just recently learned that SimplePractice can do it for you for an additional fee. Also, something to consider is that fees. So SimplePractice does use Stripe to process all payments to you from the insurance company, or sometimes the insurance company will send you a check. So the fees can add up. So make sure you keep track of those type of things. There it is, folks. That's how you build on SimplePractice. Hopefully this made more sense for you, and it seems like doable at the end of the day. And make sure you let me know what other questions you have regarding your private practice, managing your mental health business, down below in the comments. And again, if you aren't already, make sure you subscribe and like this channel, and I will see you next time.